viewers, you are watching This is News with me, Siti Istianah Syafira. I will accompany you for the next few minutes. Then, I will bring you to the most updated news. The COVID-19 pandemic in Indonesia is part of the ongoing worldwide pandemic of coronavirus disease 2019 or COVID-19, caused by severe acute respiratory syndrome of coronavirus 2 or SARS-CoV-2. It was confirmed to have spread to Indonesia on 2nd of March 2020 after a dance instructor and her mother test positive for the virus. Both were infected from Japanese national.
Since the novel coronavirus first appeared in Wuhan, China in late 2019, it has spread across the world. Coronaviruses are a large group of viruses common among many species of animals, including humans. There have only been 2 other coronaviruses that have been known to be deadly. The Middle East respiratory syndrome, known as MERS virus, that caused severe respiratory problems, and the CDC estimated that 3 out of 4 of every 10 patients infected with MERS had died. Another one is the severe acute respiratory syndrome, or SARS. Now that had an average death rate of around 10%, with older people being the most vulnerable. Viruses can spread from human contact with animals. Scientists think MERS, for example, started in camels, and they suspect that SARS started with civet cats. As for human-to-human transmission, often it happens when someone is within 3 feet of the infected person.
First of all, let's talk about the tourism industry, which will definitely be affected by this. So far, the situation here is stable. People are going about their days as usual. Although many residents have resorted to panic buying, President Joko Widodo spoke out against that, saying it's not necessary at all. What we know about the 2 patients is that they are mother and daughter, aged 64 and 31 respectively. Both of them live in the outskirts of Jakarta, about an hour away from the city center. Indonesia's health minister said one of the patients had been sick for about 2 weeks before she decided to test for the virus. They were already under surveillance for about a week or so before they were diagnosed on the 1st of March. On the 14th of February, the patients were in close contact with a Japanese national who's working in Malaysia. The main concern right now is to contain this virus, to not allow it to spread uncontrollably. And although the government has mentioned time and time again that Indonesia is capable of dealing with this virus, hospitals around the country have prepared isolation rooms and have equipment that are of international standards, the World Health Organization did mention that Indonesia should anticipate more cases in the coming days, but the main priority right now is to just reduce the risk of transmission.
Since COVID-19 entered Indonesia, the government immediately took action to break the chain of distribution of COVID-19. Encourage the quarantine community at home, conduct COVID-19 rapid tests, and educate the public about positive symptoms of COVID-19 and how to prevent COVID-19. The prevent COVID-19 is wash your hands regularly and extensively with soap and water. The additional use of alcohol-based hand sanitizer can kill virus on your hand. Maintain at least 1 meter distance between yourself and anyone who is coughing and sneezing. People who cough or sneeze spray small liquid droplets from their nose or mouth, which might contain virus. Cover your nose and mouth when you cough or sneeze. And if you feel sick, go see a doctor. Protect yourself and the people around you. Thank you, viewers. That is the news which I called to you today. I'm Siti Syafira. See you later and bye-bye.